kids in Western New South Wales, particularly Indigenous populations and other people with disadvantage in Western New South Wales, seem to be falling through the cracks due to COVID, learning remotely, especially in areas where there's COVID. What specifically are you doing to help these kids in Western New South Wales, or Indigenous kids in country New South Wales, or anyone that is falling through the cracks in a more remote area of the state?
Well, obviously, depending on where children live, there are options for remote learning, whether it's providing technology, providing that additional service. So the Education Department learned a lot of lessons last year when we asked parents to home learn and homeschool their children, or teachers rather.
Is there anything additional you're doing for those kids that you're not doing for kids in Sydney?
Obviously, we make sure that all vulnerable children across the state are taken care of, COVID or not, but especially during COVID. And as you know, for students in Western and Southwestern Sydney, who we know would be required to sit for public examinations, some weeks ago we ensured that they were offered the opportunity to get vaccinated, all the HSC students, and we're encouraged to hear that other students outside those areas are also choosing to get vaccinated. So our return to school is safe and cautious, and obviously, whilst children are asked to be home learning, whilst teachers are asked to teach students remotely, that the Education Department and the Education Minister would have ample information on how that's done. But I remember last year the New South Wales Government invested in a lot of additional technology, a lot of additional equipment, so that students who were disadvantaged actually had that at home if their parents weren't able to afford to purchase it for them.
Premier, just some clarification around the rules tomorrow. Is it still exercising in groups of 2, considering that there's groups of 5 that can... what is it about exercise?
Obviously, this has been made public for some time now, but in local government areas of concern, it remains you exercise within your household or with one other person, so 2 maximum. However, in areas outside of local government area of concern, 5 people are able to come together, 5 adults, and that excludes children under 12.
I'd like to ask you the same question as Dr. Chance, and I know you spoke about this at length on Friday, but do you have at all a concern that the lack of this setup, which lots of people in the public tune into, is going to send that impression that we've reached a turning point in the pandemic that we haven't reached yet? And what other interactive modes of health communication are you looking at? Because a video posted with the numbers doesn't give people who are confused at all the chance to ask questions of the government.
Of course, but we never said that we would change this format every day. Quite the contrary, we will provide information that is best for the community. And I was very upfront and honest to say that whilst there will be ample information provided on a daily basis, I won't necessarily be the one providing that information on a daily basis. And that's because, as I've said, I need a clear head. The next 2 months will be the most challenging our state has seen perhaps ever. And I need to make sure we are not only making decisions for the next day, but for the next weeks and the next months. And it's really important to make sure all of government is prepared for what the next few months bring us. And I'll still be a regular feature at 11 a.m, but not every day. And I was very upfront about that. And I'd rather be upfront and tell people than them saying, where is the Premier today or tomorrow? Because I need to make sure that government gets back to its usual processes as quickly as possible. Just as the community will start to reopen, government has to get back used to not running in crisis, but getting used to running and living with COVID. So government itself has to prepare for living with COVID and not just crisis managing every day. So please be assured that I will be a regular feature. That might please some people and that may not please some people. I'll still be regularly attending 11 a.m s, but not every day. And I just wanted to make that clear. Because we need to make sure that all the decisions we're making moving forward, because our state will be the first state to make these decisions. Our state's the first one to outline a roadmap in living with COVID. We'll be the first ones outlining when international travel resumes. We'll be the first ones changing our quarantine system on a large scale. There's a lot of firsts New South Wales will be required to do, and I need to make sure that we're making those decisions in a proper way with all the resources of government.